Welcome to Green Healthcare. We're here with Thomas.
How you doing, Johnny?
Thomas, how's the day going?
Excellent, excellent.
You're
So
starting
far,
your
great.
adventure.
I'm starting a new adventure going on with my life and in a whole new.
We're going to get a new smile.
Yeah, exactly. I
How's
deserve it.
How's that been?
Well, it's definitely been a long time coming. I spent a lot of time with my families and helping everybody, and now I think it's time.
It's time for you.
It's time for me.
It's time for you.
That's right.
Thomas, where are you from?
I'm from a place called Nova Scotia in Canada, just
Canada.
along the Atlantic coast, and excellent fishing and nice people.
You're like 32, right?
Oh yeah. No, I feel like I'm going to transition to 32.
All right, 32. Yeah, but
Yeah.
we're going to get you a smile at 32.
That's right. I need that smile to go along with my health, since that's all I have to worry about today.
So tell us how you got in contact with Green Healthcare, and how did you reach us?
Well, originally I was content with my dentist in Nova Scotia. However, you know what I mean, things with age and, things got brittle and I needed some more work done, and they advised me to get dentures, which I wasn't really looking forward to it.
The cost is a little bit
and
different.
The cost was a whole lot different there, for sure.
A whole lot.
So I made it into a dental
Vacation.
vacation.
A vacation.
So what better way to do it? You know what I mean?
And enjoy it. And this is your first time coming to Costa Rica?
First time in Costa Rica. I love it. I love it. It's just flora and fauna, and people are so nice.
And how's this accommodations been for you for this dental side?
Wonderful. I couldn't imagine anything better. I've got a kitchen. I got my own bedroom, shower. Everything I need here is.
And you got drinking water.
Oh yeah, the water's great. You know what I mean?
And how's the doctors been?
Doctors, I went this morning. Rebecca took me to the dentist, and I was amazed at the technology and how everything is done under one roof. And I think that's a bonus, as far as, like, instead of paying somebody else.
So what Thomas is talking about, a lot of times when people get dental treatments abroad, sometimes everything's not in the same spot. Uniquely with Green Healthcare, we choose facilities that have everything on site. Nothing's gone to third parties. Everything's on site. And you've seen it for yourself. It wasn't just, I showed you a virtual, you've seen it.
Yes, yeah, I've seen it firsthand, and the service and the people were just so accommodating. There was no waiting in a waiting room for, past somebody else's. They took me right in and showed me the equipment and the procedures, and took I think it was a 3D image of my.
Oh, your 3D app. You have
Yeah.
the 3D scan of your
and
mouth.
showed my bone structure and where they're planning on putting implants, and they suggested what I'm going for, and that's
the all-in-4 upper and lower.
all in four. Yeah.
So those of you that are thinking about doing an all-in-4 and dental sides, big factors is always to have enough bone. And
Yes.
having that scan inside always gives you the assurance, your peace of mind.
Yes.
That's the most important.
Yes. And I don't think the dentist had that technology in Canada, so I'm surprised at how.
It's here in
advanced.
Costa Rica,
it's here in
right?
Costa Rica before.
Yeah, well,
However, you know what I mean.
no, everybody, the thing is that bigger countries, a lot of times, those equipment goes farther to other specialized groups. And
Exactly.
things.
Yeah.
But it's here, we try to do that. So tell me in a nutshell, would you recommend this type of experience?
Definitely.
Or
It's just so much more here to offer. Everything's the whole package. You get they picked me up at the airport. They were there with the sign with my name. Being not fluent in Spanish.
kind of helps a little bit.
It helped a little bit. It was a long
And
drive.
your first time here.
Yeah, my first time here, and it's just wonderful waking up in the morning and seeing the beautiful
This paradise.
canopy. Yes, exactly.
And that ride over here, how was Charlie?
Charlie was great. Just going up the mountains and going around the turns, and you know what I mean. It was.
He made you feel okay.
He made me feel very good. I couldn't have drove it myself. You know what I mean. So
Yeah.
I was glad that Charlie was there to pick me up, and he took my hand, and everybody's been very helpful so far.
Well, thanks, Thomas, for taking the time to talk with us
Thank
a little
you
bit
very
and,
much.
and sharing with other people that
Yes,
it is possible.
I'd love to see more Canadians, come down to Costa Rica and get some work done for themselves. And that's what it's all about, getting your work done this time.
With quality, without compromising any quality.
Exactly.
Well-
Thank you very much, Green Health, for all your accommodations and help me with any requests.
Well, thank you. Well, those of you, you got this. This is non-scripted. This is just
Yeah.
done on
Yeah.
on the fly here with Thomas. His first time in Costa Rica. Can you imagine that? And he's getting dental treatment.
Yeah. Unreal.
First time.
Yeah, first time.
Well,
Won't
you
be
guys,
my last.
and you're coming in back a few months,
Yeah.
and we'll do a finished product when you
Oh,
got all the pearly whites in. And,
Yes, that's what I'm looking forward to. And
all right,
All
you
right.
guys take care.
Thank
Pura
you.
vida, and always be safe.
Pura vida.